Hello, my name is Victoria Lentz, and I am the Director of Student Health Services at Salisbury University. I'm also a nurse practitioner. I'm going to talk about coronavirus and how Student Health Services is preparing for when students return to campus in the fall. We are preparing by increasing our staff. We are in the process of hiring a medical assistant as well as another part-time nurse practitioner. We will continue to have coverage from our physicians that also work in local emergency rooms. We are in the process of acquiring a point-of-care test for COVID that would give results in 45 minutes. We are fortunate to be able to collaborate with the College of Health and Human Services Nursing Department. Second-degree nursing students will do a clinical rotation with student health. The university has contracted with a 24/7 after-hours phone triage and advice service for students. Finally, the university has planned for the use of another space on campus to separate students seeking care for well visits from those that have respiratory symptoms. And we will have the use of an outside tent for COVID testing. So I've been working with the COVID-19 task force and the university health team, as well as with Housing and Residence Life. I communicate regularly with the other University of Maryland Health Center directors, and we are in negotiations with the University of Maryland at Baltimore Lab for on-campus COVID testing. I'm also helping coordinate services for employees. There will be medical support for employees separate from student health services. Student health services is the campus provider for health services for students. And as far as employees, there will be someone available to provide information and assistance with regards to COVID-19 questions and testing, with support from the whole campus health team. There will be more information coming for employees regarding the support for services in the fall. Although many people with COVID do not have any symptoms or just mild symptoms, you should monitor yourself for symptoms of a fever, generally above 100.4, a cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, a headache, new loss of taste or smell, a sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. If a student tests positive because they have symptoms, depending on where they are living, we will recommend that they go home to isolate. We will follow up by phone to see how they are doing, and we will provide the phone number for our after-hours triage service in case they need assistance. For students that live on campus, again, we will recommend that they go home, or on a case-by-case basis. If this is not possible, then Residence Life will make arrangements for their isolation on campus and will assist with their services such as dining. Students that are awaiting test results may quarantine on campus, and again, we will coordinate with Housing and Residence Life for additional services needed. And we will contact the Wicomico County Health Department to begin contact tracing. So asymptomatic spread is when a person has the virus, probably in their respiratory tract, and has no symptoms whatsoever, but can still spread it when they cough or sneeze or forcefully talk or sing. And that is called, that has to do with why there's a lot of community spread, in that people don't know they have the virus and are going about their normal activities and spreading it to people who may be more vulnerable. To curb the spread of COVID-19, we all have a part, and that is if we wear masks, if we practice social distancing, and if we wash our hands. And we don't go to places where we're in close contact with others, such as bars, restaurants that maybe are not practicing social distancing. Everybody is at risk for COVID-19. And again, symptoms can range from mild to severe and have different complications for each person. Older people 60 and above and those with pre-existing medical conditions have a higher risk of serious illness. The current Maryland Department of Health data shows that the majority of infections are in adults under the 60 years of age. So all people need to practice social distancing and wear masks to prevent the spread. The University System of Maryland last week released a statement on COVID-19 testing and symptom monitoring for students and employees who are returning to campus for the fall semester. More information will be coming soon. I can tell you that we are going to test students before they return to campus and on a regular basis to monitor the cases at Salisbury University. And the university will cover the cost for testing. And we are bringing in some help from a variety of sources to facilitate and handle all these new and important testing procedures. As you can see, this is going to be a complex process, and we are still working out all the details. When we look at surveillance testing for Salisbury University, that would be taking a random sample of our population and doing tests on a regular basis to see what the amount of virus is on our campus. The best advice I can give students as you prepare to return to campus is to purchase a thermometer and get in the practice of taking your temperature daily. Buy multiple masks so that you can always be wearing a clean one each day. Monitor your health and complete the daily screenings that you will get information on soon. Plan out your activities and think about your pod or those people in your small group. Make sure that all your vaccines are up to date. And when it is available, this is really important, you need to get a flu shot. Practice good hand hygiene and look out for communications from Salisbury University. A pod will be those people, think of it as your family. Right now you're all at home with your families and that's your pod. And maybe there's a few of your friends that you've been in contact with, but you know that they've also been with only a few people. So as you come back to campus, think about who is going to be in your pod, because that's how you're going to protect yourself and others. If students are not well when they come back to campus, they can contact us through our secure student health web portal, myhealth.salisbury.edu, and request a phone call back, because we want to do some phone triage before a student comes into the health center. So the best way to contact us is through the portal or through phone, which is 410-543-6262. When students return in the fall, we want them to know that student health services will be available for all the services they previously had, which would be routine women's health, complete physical exams, allergy injections, immunizations. We do want students to call before they come or when they set up appointments so that we know why they're coming in, so that we can keep students who are coming for well visits away from students that might have more sick or respiratory visits. And please contact Student Health Services with any questions.